So again, thank you for being here. Once again, welcome to the 47th Annual National Food Policy Conference. And now, to kick off our program, I'm pleased to welcome to the stage the U.S. Food and Drug Administration's first ever Deputy Commissioner for Human Foods, Jim Jones. Since September of last year, Deputy Commissioner Jones has taken the helm of a newly redesigned human foods program at FDA. He's a longtime veteran of the U.S. Environmental Protection Agency, where he led the 2016 overhaul of the Toxic Substances Control Act, as well as several national-level sustainability programs, including the Environmental Preferable Purchasing Program and the Presidential Green Chemistry Awards Challenge. I first met Deputy Commissioner Jones when he served on the Reagan-Udall Foundation's expert panel charged with evaluating FDA's human foods program. And like many of you, I was very impressed with the report that they put out in part of that process. But what I was really impressed with Deputy Commissioner Jones was when his name first surfaced, people that couldn't agree on whether FDA should be funded were in just wrapped harmony about what a great choice he was to lead the Human Foods program. And since his appointment, I've been really impressed by his commitment to transparency. Recently, I received the fastest response to a FOIA request I've ever received in my professional career as a public interest advocate. And maybe it was just subject matter, but I like to think maybe he had something to do with that. So we know there are a lot of strong opinions about what FDA is doing. And he's definitely got his work cut out for him, but he's given us hope for reason for cautious optimism, and we are thrilled to have him with us today. Deputy Commissioner Jones, thank you for being here.
Thank you, Thomas. It's been fascinating. I was an assistant administrator at the EPA, which arguably is a higher rank, but nobody ever called me assistant administrator. It was that guy or something else. But there seems to be an absolute fascination in the FDA world to use the term deputy commissioner. I was on my, I keep telling my staff, Jim, call me Jim, call me Jim. Deputy Commissioner Jones, Deputy Commissioner. I had to do a call one day with my, I was driving, and my wife was driving, and I was doing the call, and it was on speakerphone, and she just could not stop chuckling at how many times Deputy Commissioner Jones was mentioned, but I should take it as a compliment. It's great to be with you all today, and I know for many of you, the proposed reorganization of our food program and how it will impact our approach to food safety continues to be of significant interest. As you're likely aware, the proposal for a unified human foods program was submitted by FDA Commissioner Califf at the end of 2023. It's currently undergoing a formal external review process required of all major federal reorganizations. We are very hopeful that implementation can occur sometime in fiscal year 2024. Our vision for this work is already taking shape. We are focused on making food about wellness through ensuring food safety, enhancing food chemical safety, and improving nutrition. Once the structure is in place, we will have an organizational framework that supports and facilitates a systematic risk management approach to achieving these goals. As we are currently resourced, prioritization and risk management is how we can zero in on those issues where intervention has the greatest opportunity for the prevention of disease and illness. The success of the new Human Foods program will largely be measured by the safety of the U.S. food supply. And while we are fortunate that ours is among the safest food supplies in the world, for every foodborne illness, outbreak, and contamination event, there is a human toll which can be devastating for those individuals impacted and their families. And each time the credibility of the FDA and that of the entire food safety system is questioned, and consumer confidence in the safety of foods is diminished. During these events, there is also a call for FDA to do more to police the food industry. But we are neither resourced nor organized to rely exclusively on compliance actions as the incentive for industry to meet its responsibilities. Moreover, catching industry at failing is not the most effective way to achieve our goal of having a safe food supply. The food safety system is a partnership based on the mutual understanding that it is in everyone's best interest for the food supply to be safe and nutritious. And as we work toward these goals, it is essential that we work closely with the food industry, with domestic and foreign regulatory counterparts, and with consumer advocacy groups. The focus on prevention of disease and illness attributed to food was solidified 13 years ago when the Food Safety Modernization Act ushered in the reshaping of the food safety system. FSMA gave FDA substantial new authorities and responsibilities and a framework for a prevention-oriented system to improve public health. Through 9 foundational rules and over 70 guidance documents, the FDA, together with our state and international partners, has worked over the last decade plus to support industry in meeting the requirements of FSMA. FSMA also made clear that the food industry is responsible for identifying hazards and implementing practices to prevent contamination, having systems in place to respond to food safety failures, and ensuring they comply with all relevant requirements. One area where we and industry need to do a better job is imports. To help ensure that imported foods are produced in a manner that provides the same level of protection as expected of domestically produced food, FSMA called for a fundamental shift in the imports paradigm. Under the Foreign Supplier Verification Program, or FSVP, importers are required to put in place a program for verifying that the food that they import meets all the applicable safety requirements. Our inspection activities for the past few years indicate that many importers are unaware of this requirement. The recent lead and cinnamon applesauce incident highlights the need for greater awareness on the part of industry of these requirements and the need for FDA to give greater attention to FSVP implementation. Another clear strategy is end product testing. This can immediately help safeguard the food supply and ensure that foods with unexpected levels of heavy metal, such as lead, do not make it to market. Because FDA cannot require companies to conduct this type of testing, we have asked Congress for additional authority to require product testing of foods for contaminants and to make the records available for FDA. I'd like to also spend a minute or two on two FSMA rules, the Ag Water Rule and the Traceability Rule. This spring, we'll be finalizing the Ag Water Rule. Through this rulemaking, we are leading the world in laying out a system for assessing potential hazards that could impact the safety of water used on produce prior to harvest, and a risk-tiered approach for addressing these hazards in order to keep produce safe. The team at FDA, I make that mistake a fair amount, is currently working on a number of fronts to develop resources so that we are ready to support compliance once the rule is published. Another major FSMA rule where a lot is happening is the traceability final rule, which requires specific record keeping for certain foods. Successful implementation will help us achieve a safer food supply that is equipped to respond quickly and in a targeted fashion to foodborne illness. It will also help reduce the tremendous waste of food and resources that occurs when recalls cast nets that are overly broad because we lack critical information to target only the implicated product. Unlike other FSMA rules, the traceability rule requires communication and sharing product traceability information between members of the industry and between industry and the FDA in a way that hasn't been required in the past. There is no question that this is a heavy lift. We are keenly aware that we can't achieve the intent of the rule if the requirements can't be met in the timeline we have set out. With compliance dates 20 months out, we are committed to working with industry to get this right. Sorry, lost my page here. I want to pivot now to our chemical safety programs. Our Closer to Zero program offers a great example of where collaboration can help move the needle on food safety. For those of you not already familiar, Closer to Zero is a multifaceted initiative to contend with the realities of the growing environment and respond to emerging science on the potential risks of early exposure to heavy metals. The cornerstone of this program is developing guidance to industry on action levels that are health protective and also feasible for industry. We are working on issuing action levels on lead for foods intended for babies and young children, followed by action levels for arsenic and cadmium. I want to be clear about action levels and our authorities under the Federal Food, Drug, and Cosmetic Act. The agency has authority to pursue action against any product at the minimal detectable level of the contaminant when it is injurious to health. Action levels and tolerances represent limits at or above which FDA will take legal action to remove products from the market. To help support reductions in the commodities used in food, we're working closely with USDA and in collaboration with manufacturers and growers to identify solutions. We plan to expand this approach beyond baby foods since children only eat them for a short amount of time, and we will look to stakeholders to help us identify other foods where action levels would be appropriate. Ultimately, if we can make small reductions in heavy metals in a whole swath of commodities, it can result in a significant reduction in exposure to heavy metals from the overall diets of our children. Food safety is not only about protecting food from contaminants, and in our new human foods program structure, our work on chemical contaminants and food additives will be housed in the Office of Food Chemical Safety, Dietary Supplements, and Innovation. And as part of our work to enhance food chemical safety, we are embarking on creating a systematic framework and criteria for prioritizing chemicals for reassessment. As we have seen in the past, when new data and information become available, post-market safety reviews can raise important questions. Most recently, with our announcement about the removal of PFAS from grease proofers used on paper food packaging, the safety review is critical to working with industry to secure a phase-out that eliminates the primary source of dietary exposure to PFAS from food contact applications. We updated our list of additives and contaminants we have targeted for reassessment, and in the year ahead, we will continue to share updates on this list and information about the development of our framework criteria. The most frequent question I get is how can FDA influence state chemical restrictions? My answer is that FDA needs a more ambitious post-market chemicals program. We'll also be continuing our focus on nutrition, and in the future through our dedicated Nutrition Center for Excellence in the new Human Foods program. In many ways, improving nutrition can be thought of as the outermost limit of food safety prevention. The goal for all of our programs is essentially the same: the prevention of illness and disease and the promotion of wellness. And across our efforts to promote food safety, we are very intentional about maintaining access to foods that supply vital nutrients. We know that fruits and vegetables, whole grains, and dairy are critical for healthy development, and that good nutrition is essential across the lifespan. Right now, with all the health metrics related to diet-related preventable disease going in the wrong direction, improving nutrition offers us one of the best public health interventions for reducing chronic illnesses and premature death. Providing information is a key strategy when it comes to helping support consumers in making decisions around nutrition. And in the year ahead, we are working on 2 labeling efforts to make it quick and easy for people, particularly those with lower nutrition knowledge, to identify healthier foods. The first is a long time coming, with our finalization of the definition for the nutrient content claim, healthy. We are considering the comments received to the rulemaking, as well as the current dietary guideline recommendations in nutrition science as we work to finalize the rule. On a separate track from the definition is our consumer research related to work to develop a healthy symbol that could appear on food packages. We're also working on issuing a proposed rule for front of package labeling. We have conducted extensive outreach to get stakeholder input and are carefully considering the input we received, as well as lessons from international experiences. Once the proposed rule is issued, I encourage you to submit comments and other information. In addition to labeling, we are targeting two specific nutrition issues. Most people in the U.S. consume too much sodium and added sugars from processed, packaged, and prepared foods, and I believe the FDA, industry have a meaningful role and responsibility to help advance diet changes and bring down the rates of obesity and other chronic diseases. For sodium, we are currently developing the second set of draft sodium reduction targets. The data so far from our first round of sodium targets is preliminary, but for the most part encouraging. We expect that lowering sodium in the food supply will be a gradual, iterative, stepwise process to allow for reformulation and to help consumers' palates adjust. We will continue to monitor the food supply to see what the impact is. We are also targeting reductions in added sugars. Added sugars is a good example of where we benefit from a whole-of-government approach. The science that supported the Dietary Guidelines for Americans in 2015 supported our requirement for added sugars to be declared on the nutrition facts label, and now USDA has proposed limits for added sugars in school meals. We are still in the information gathering phase. We are reviewing the comments we received to our public meeting at the end of last year, and we will continue to work with our federal partners in determining how to address the overconsumption of added sugars. Before I turn it over for your questions, I'd like to emphasize that none of what we can accomplish can be done by FDA alone. Key to the vision of a unified human foods program is strengthening our relationships across our stakeholders. For us to successfully reach our goals for food safety and nutrition, we must leverage the expertise of our network of stakeholders and partners. We each bring different tools, information, and resources, which if we work together, we can use to make a difference in the health and well-being of our fellow Americans. This doesn't mean we'll agree on everything. Difference of opinions and strategies inherent in these types of conversations. But by coming together and finding common ground, we're in a much better position to identify solutions that work for as many entities as possible. To make the type of measurable and sustainable improvements to public health that FSMA and the Human Foods Program have set for us, we need the collaboration of our wide array of stakeholders. Thank you for having me today, and I look forward to our working together.
So there's a microphone up here for folks that would like to ask a question.
Thank you very much for your wonderful overview of what you're trying to accomplish at the FDA. I'm Michael Jacobson, founder of the National Food Museum. You emphasized that the FDA is going to follow a risk-based approach to allotting resources to focusing attention. Tom Frieden has estimated that excess sodium is causing as many as 100,000 deaths per year. I suspect that's more deaths than just about everything else you're working on combined. I'm wondering how many dollars, how many FTEs are assigned to pressuring industry and educating consumers to reduce sodium consumption?
So it's a great question, and sodium is definitely a high-risk issue for Americans, which is why we're focusing on reducing sodium in the diet. And so our budget does come to us with a range of restrictions on it, and the dollars that we get for nutrition are quite modest, I will say. It's probably of the three major risk areas that I talked about this morning, nutrition is by far the smallest, and that is associated with the amount of money that we get for nutrition. I don't have the exact dollar amount on my head, but it's absolutely the smallest when it's compared to chemical food safety or microbiological food safety.
Has the FDA had even one full-time staffer working to pressure industry to lower sodium?
So we've got a rather significant team of numerous people across many parts of our organization that but clearly, when you add them all up, are more than one FTE. I wouldn't say pressure. Pressure is not our statutory authority, isn't to pressure. It is to help manage the food supply in a way that makes it healthier for Americans. And that's what our sodium reduction goals have been about.
You know, I suggest that you look at the British program from roughly 2005 to 2010 as a successful program to lower sodium levels that had media advertising, press conferences, and direct pressure on industry. You could call it persuasion if you like. But it is far, far more than what the FDA is doing to reduce that awesome death toll.
Thank you. I appreciate that. We'd learn a lot from our international partners. That being said, I will say Congress has been very reluctant to give FDA money for advertising or marketing.
Hi, my name is Shelley Maniscalco from Nutrition on Demand. It's very exciting that Healthy will be finalized and that will be consistent with the dietary guidelines, taking a food group approach, and as well as being updated to the current dietary guidance versus years past. I'm wondering what your approach will be to updating the qualified health claims as well. As you know, they're currently associated with very, very, very old dietary guidelines, which have a limit on total fat and does not distinguish between the healthier fats and saturated fat, as well as different nutrients of public health concern.
Yeah, so I have to say I've yet to spend much time on the qualified claims yet, but I've got some folks here who I bet know the answer to that, so maybe at the break I can connect you with them and we can get you an answer.
Great, thank you.
I appreciate it. Thanks.
Hi, thank you for being here. I'm Dr. Katie Wilson, Executive Director of the Urban School Food Alliance. So we represent the largest public school districts in the country and their school lunch programs. We spent 2 years trying to get antibiotics out of the poultry system and the way we were purchasing and procurement. And now, of course, we've heard all these announcements like Chick-fil-A, and it's really because the largest supplier in the country is decided not to do this anymore. And so this whole issue of antibiotics not for human medicine, and we work with the George Washington Antibiotic Resistance Center, and so there's not the science to show that isn't impacting human health. So is FDA looking at antibiotics that we're really disappointed because, of course, it's hurting us in our effort to take antibiotics out of particularly the poultry supply and school meals. Is FDA looking at antibiotics in any way, shape, or form, or this whole issue of not used for human medicine?
So the Center for Veterinary Medicine, which is not in my remit, has the lead on that, but I'm talking to that director this afternoon, so I'll pose that question to her, and if you give me your card, I can get back to you on that.
I'd be grateful. Thank you.
Yeah, sure. Take it.
No one wants to ask a question. I wanted to ask a follow-up question on your comment about the post-market surveillance of food chemicals, and maybe you could comment on the New York bill that requires the disclosure of the secret GRAS determinations, and kind of why is that not an approach that FDA is prioritizing?
So GRAS is an interesting feature of the FFDCA. The manufacturers do have the ability, if they meet certain criteria, to make a self-determination that a food is generally recognized as safe, and they don't actually need to inform the FDA of that. I personally view that as a weakness in the system, in that it creates the sense that there isn't any government oversight. Our experience is that the vast majority of manufacturers voluntarily submit their GRAS notices to FDA for us to review them, and periodically we will send them a letter saying this doesn't meet the criteria. We have created that voluntary mechanism because we think without it, it undermines the sense that the food system is safe. We actually have very little evidence that manufacturers are doing GRAS determinations and not noticing us. We do some monitoring of the food supply, and so if we were to find a chemical that wasn't in our inventory, either because we had approved it or because the GRAS was voluntarily submitted, that would be a signal to us that there was a possible either it was just a violative ingredient or it was a self-grass determination, but we'd follow up. We do not find that very often. So it does not seem that the manufacturers are doing GRAS without giving us notice. So we feel that, I'm sure the number's not zero, but we feel that the vast majority of GRAS determinations are being submitted to FDA. We do review them. They get a review. The review is fundamentally the standard of reasonable certainty of no harm. And as I said, periodically we find a GRAS submission does not meet that standard, and we post that those reviews are available. So I think GRAS is a very challenging one because it's allows for the self-certification of generally recognized as safe. But as I said, we create a pathway for manufacturers to voluntarily submit, and they seem to, for the most part, more than the most part, the overwhelming majority do seem to submit them to FDA for review.